In the Lone Star State, we cherish our freedoms and hold our families dear. But when it comes to healthcare, the challenges we face are as diverse as our people. Every day, Texans grapple with the consequences of bad actors in the medical field. That's why we created Texas Best Docs. We're here to help families protect their loved ones and make informed healthcare decisions. Welcome back to Texas Best Docs, where we celebrate the heroes of healthcare and help Texas residents make informed healthcare decisions. I'm your host, Kalee Pair, and today we have a very special guest with us, Dr. Divi Puttagunta, an internal medicine medical specialist at MSA Dallas, and your lifelong Texan with over 16 years of experience. And today we'll be discussing with her about insights in healthcare and her experiences, as well as the exciting work being done by Texas Best Docs. So I want to say hello and welcome. Thank you so much for being here today.
Thank you for having me.
So I want to start by kind of talking about your journey. How did you get into medicine, and what was that journey through medicine and your schooling and everything? How did you get into internal medicine?
So since I was a child, I wanted to help people. I wanted to do more things for the community, as well as making people feel better. So I chose to be a doctor from a young age, did pre-med at UT Dallas, and then went into UT Southwestern for medical school as well as residency. So since then, I wanted to stay in Dallas because my family is here. And so I got an opportunity to interview and stay in Dallas with MSA, and I've been there since 2008.
Wow, that's amazing. And so how many years for, somebody that may be watching that's thinking about getting into medicine, what does that look like year-wise?
Got it. 4 years of undergraduate degree. So that's 4 years, just any undergraduate school, pre-med, and then afterwards 4 years of medical school, and then residency. So residency varies upon, the length varies upon if you do, what kind of specialty that you do, and if you do a fellowship or not. I decided to do internal medicine. Internal medicine is a study of just adult medicine, just like there's a pediatrician for kids. This is an adult doctor, even though that's not in the name. It could be kind of confusing. So I decided to do internal medicine. That's 3 years. And I decided to stay as a general internal medicine doctor. So practicing primary care for adults.
That's amazing. Actually, I didn't know that's what internal medicine actually was. So
yes,
I learned something today. So that kind of answers the question about the experience in the medical field. You're working with the patients day to day. So one of the questions that is, I think, really important for somebody listening or watching is, what would you want a patient to ask you, or what is important for them to advocate for themselves with another doctor, before they get care or during their care?
I would say, it's good for a patient to get across what their story is and what their concerns are. Sometimes it takes a little while to get to that point. Are they recovering from, a hard situation, such as their husband passing away a year or two ago? What's their living situation like? What are the things that affect their health that they're concerned about, and what are their priorities? Everybody has a slightly different view of how they want their health care to go and what their priorities are. And it's good to get a doctor that focuses on not just getting things done for the immediate medical issue at hand, but also takes a broader view as far as what are the patient's priorities.
Yeah, that's really interesting because, a lot of people say you're your best advocate. So, tell the story, make sure that you're front and center in your journey as well, not just the doctor, right?
Right.
Awesome. So in your opinion, do you think what has changed in the healthcare field over the last 5 years, whether that's good or whether that's bad? Do you have any insight on how much it's changed?
So I've seen some change with regards to insurance and accountable care organization and those types of organizations and how they relate to us in the primary care field. Payments have changed, for sure. The requirements upon doctors and the types of things that are followed through these organizations have changed.
Can you explain that a little bit more for me. I don't know what those organizations are per se.
So an accountable care organization, it was created through Obamacare, essentially. And so what an accountable care organization is, from my point of view, I'm not an expert on it, is basically it's a set of doctors, say hospitals or groups and specialists that come together and say, okay, we're part of this accountable care organization. We are going to take care of a set of patients, and we ultimately are going to provide quality care, and also we're going to provide that care at a lower cost.
Okay.
By not replicating tests, by not having readmissions and hospitalizations, things along those lines. So that's the idea behind an accountable care organization, is coordination of care, so that it's more efficient and also less costly. And so it started with Medicare, or they are Medicare programs, so that part of the money that's saved for Medicare is then returned back to the accountable care organization and then shared with with doctors, particularly primary care doctors, since we're the quarterback in this whole thing. So there's been a lot of changes with regards to the ACO programs and also the Medicare Advantage programs that kind of go along with those, which are the Medicare Advantage is the commercial offering of Medicare, is the best way that I could see it. So, I mean, without going into the nitty gritty, there's just been a lot of changes in that front, and we've had to change along with it. And, in the last 5 years, we've had the pandemic, which was a huge thing, as far as changing how we deliver care through televisits. And also, it's kind of spurred on a lot of other changes as far as access to care and things along those lines.
So would you say, is it make it harder for you, or is it kind of both as a doctor?
So there's some things that have been easier with regards to COVID spurring on like more televisits. Those are covered now all of a sudden, whereas before the pandemic they weren't. That was the only way we could deliver care. So that was a good thing that came about.
Yeah, no, that's great.
But not so good things are kind of insurance companies and Medicare kind of cutting back on payments, and our costs of running a practice going up.
Yeah.
Therefore, a doctor has to see more patients in order to cover costs as compared to previously.
Interesting. We could probably go on for a little longer. I have a lot more questions. Yeah. But I'm going to spare you that because the reason that we're here today is for Texas Best Docs. So I wanted to kind of expand a little bit more on how do you know the founders of Texas Best Docs?
So Chad he's right here. He's our COO of MSA, the practice that I work in. And therefore, that's how I got to know about Texas Best Docs. I think he's one of the founders.
Yeah. Yes. And so, I know that you're just kind of getting, as this launches, involved in Texas Best Docs. So I want to kind of skip to a question where, as a physician, why do you think that this is important? And for those of you that are just joining us, this website, you can go and look at any of our other previous episodes or get to know exactly what it is that you can do. But it's at your fingertips, able to keep track of doctors, or if you're new, which is huge nowadays. Like, it didn't used to be where people all stayed in the same areas, but now people are moving everywhere, and to be able to research a doctor, it's huge. But as a physician, I really want to know kind of how it helps you.
I think it would help with regards to if I'm referring to a specialist, I'd like to know if they continue to be in good standing with the boards, and if there's any complaints against them and so forth. So that would affect who I would refer my patients to. And my patients put a lot of trust in me as their primary care doctor, so I want to make sure that I help them navigate the healthcare system the best way possible. So that's how it would help me.
Yeah. And with the other side for patients, why do you feel like this could be so impactful, so important to have in the healthcare industry?
It's a validated method that's outside of any subjective material that might be out there on websites and patient reviews and things like that. And so it's nice to have an outside entity double check credentials and board certification and complaints and things like that, so that the baseline is taken care of.
Yeah, and so, there are, several stories out there where there's physicians that aren't allowed to be alone in a room with a female patient because of board actions or issues. As now taking your physician hat off and putting it down, and just as a mother, as a daughter, as a wife, having a tool like this, how can you explain how that would make you feel as a mother?
I think it would certainly give some reassurance, that the doctors that you are seeing, that you are going to establish a relationship with, are the right ones, for you.
Mm-hmm. Yeah, I think it's as a person who isn't in the medical field, who is now just kind of learning about a lot of this stuff, it is, I think, very enlightening to me to be able to track this and have this tool and be able to keep up with it, whether it's a doctor I've had for years or whether it's a doctor that I'm now just starting to go to.
True.
Yeah. And so, as we talk about, Texas Best Docs, and we talk about you as a physician and as a doctor, as patients navigate this, especially with telehealth and that coming into play, hey, how important is the telehealth and being able to do that in healthcare now, and having this so that you can make sure, even though there's a screen in between you, your health is still at the most importance there, and not just taking it as, because like for me, if I'm like, okay, I'm just going to do a telehealth visit, not that big of a deal, it's still very important that you're seeing the right person for you. Can you kind of expand on that a little bit?
It's anybody that's associated with patient care, they have the ability to prescribe medicines and alter a plan of treatment. And so regardless of whether it's telehealth or an in-person visit, it's still important to know that doctor's credentialed properly, that there's no complaints against them and so forth. Yep. So that they're practicing medicine the way it's supposed to be.
What are the most common conditions that you are seeing coming into your practice today?
So a lot of the patients that come to see me are middle to older age, females or males, but females because I'm a female and most females like to see a female doctor. And so osteoporosis is really common. And it's a preventable thing to a certain degree. High blood pressure, diabetes, these chronic conditions along those lines, and we tend to manage them pretty well.
And what would you say that all of those are more preventable, or just the osteoporosis, or what are some other conditions that we can prevent, that we can do something now for?
I would say all of those are preventable. And then I do a lot of wellness exams and cancer screening, immunizations, things along those lines to prevent disease and illness. So certainly going through with cancer screenings such as mammograms and colon cancer screenings is quite important. And then, lifestyle choices that we make right now affect health later, or can affect health even now if, for instance, somebody's diagnosed with hypertension or diabetes or osteoporosis or some other preventable kind of disease. How we exercise and eat affect that significantly. So I counsel patients on a Mediterranean-style diet, how they can start exercising a little bit more. For women, especially if we're more into cardiac aerobic kind of exercises, doing more weight resistance exercises is very important, and that helps prevent osteoporosis. So I see a large kind of breadth of the population. It's interesting because I see a lot of women who have been doing, these kinds of exercises and lifestyle modifications for quite a while, and they're in their 70s, 80s doing wonderfully. And so I know these things can be prevented, and that's what I try to promote in my practice.
Yeah, no, I mean, that's at age in the late 30s and finding out some different things about autoimmune diseases and stuff like that, and changing that lifestyle. I hear you. I see you, that these are really, really important. And yeah, so I'm going to do that right now. All right. Do you have anything else that you want to share before we wrap up today?
I think, having a primary care doctor is quite important, I think, and having a relationship with somebody along those lines is quite good as far as your long-term health and preventive care. So I would urge your listeners to to kind of make sure that they have the person that's right for them, that suits their needs, and puts their priorities first.
Yeah. One question for our listeners.
Sure.
With finding a primary care doctor, because I'm guilty. It's been 2019 since I got here, and I do not have one.
Got it.
Okay. But when I was trying to, it was COVID and nobody was accepting new patients, or at least in the office. So how long when you're trying to see a new doctor? Because I know, at least for me, I'm speaking from experience, that calling and being like, oh, I can't see you for the next, I'm a right now person. I am a,
sure.
When I need it, that's when so when I, call and they're like, oh, it's going to be about 3 weeks to a month. Well, it's like, all right, cool. See ya. So what kind of advice would you give me?
So I would say, you're looking for episodic care. You look like you're in your 20s. I don't know how old you are, but many times that's fine, when you're in your 20s. But as you get older, like once you kind of get into your mid-30s or 40 plus, right, you probably want to have somebody stable to go to, that not just does wellness checks for you, but can also see you for that episodic care. So sometimes it might take a couple of weeks to get in. Hopefully, we try to make it easier at MSA Dallas by having online scheduling. So you could see who's available when and hopefully get in a decent time period, but not everybody has that. So it's important, I think, just as you get older to try to find somebody, even if it's a few weeks away, and make sure that they're able to take care of your needs when you need that episodic care also. So
don't procrastinate. Do it now. Well, thank you so much. Really appreciate you joining us and sharing your insights and experiences with us. It's been an enlightening conversation, and we're really just so happy to have you. So thank you.
Thank you for having me again.
Yeah. Well, thank you again for our listeners for tuning in to Texas Best Docs. Don't forget to visit us on www.texasbestdocs.com to get started on finding the best healthcare for you and your family. And as we said before, you can stay informed in your healthcare decisions for less than a Netflix subscription. So if you have any questions or feedback, feel free to reach out to us through the website, or you can follow us on all social media platforms at Texas Best Docs. And you've been listening to Texas Best Docs with Kalee Pair and Dr. Divi. If you've enjoyed today's episode, please subscribe. Leave us a review wherever you listen to your podcast. And if this is the first one you're listening to, please go back and watch the other ones. Very enlightening stuff. And you can always comment below if you have any questions that maybe you want us to ask in our next podcast. So until next time, take care and stay healthy, Texans.